Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is oscillopsia? Oscillopsia is a visual disturbance that makes it seem like things you're looking at are moving when they are not. Oscillopsia is not a condition but a symptom associated with neurological disorders like epilepsy, inner ear problems like Menieres disease, or eye motor problems like nystagmus. /r/n/r/n oscillopsia may resolve on its own once the underlying condition is treated, but chronic, persistent cases may require medications or visual therapies to help you better cope. /r/n/r/n This article describes the symptoms and causes of oscillopsia, including how it is diagnosed and treated. /r/n/r/n The most common symptom of oscillopsia is the feeling that objects and surroundings are moving even though they are stationary. People with oscillopsia often report that they see things jumping, vibrating, shaking, or jiggling. This might happen when your head or body is moving or when you're staying still. /r/n/r/n Oscillopsia can trigger other symptoms, such as /r/n/r/n Oscillopsia is largely associated with dysfunction of the vestibuloocular reflex, VOR. This is the mechanism involving the eyes, brain, and inner ear that helps you maintain balance and perceive things accurately while moving your head or body. /r/n/r/n When your eyes and head are not in sync, objects will appear to be moving even if they are still. /r/n/r/n Among the medical conditions associated with VOR dysfunction are /r/n/r/n If you have symptoms of oscillopsia, your healthcare provider will review your medical history and ask questions about your symptoms, including when you experience them. They will also conduct an eye exam to check for any problems with your eye alignment. /r/n/r/n Your provider may also perform an oculomotor test. This involves moving your eyes horizontally and vertically to assess how severe your headaches, dizziness, nausea, and fogginess are on a scale of 0 to 10. /r/n/r/n To identify the underlying cause of oscillopsia, your healthcare provider may order additional tests and procedures, including /r/n/r/n Opsillopsia is treated based on the underlying cause. When it is related to VOR dysfunction, the chances of recovery are good. This is because the brain has the ability to rebuild neural networks, referred to as neuroplasticity, after the underlying condition is resolved. /r/n/r/n Even so, people with oscillopsia need to manage their symptoms, and there are treatments that can help. With certain chronic conditions, like multiple sclerosis and epilepsy, ongoing management may be needed. /r/n/r/n There isn't a specific drug to treat oscillopsia, but the following are sometimes prescribed to help reduce abnormal eye movements that contribute to oscillopsia. /r/n/r/n An optometrist can help with exercises that strengthen the eye and improve eye control. A range of exercises can help improve the symptoms, including looking at lines using different filters and lenses. /r/n/r/n Vision therapy also helps with eye movements. People with oscillopsia who participate in this form of treatment can potentially regain control over eye movement, especially when the condition is in an early stage. /r/n/r/n The prognosis for oscillopsia will depend on the diagnosis and stage of the underlying condition. Some problems, such as VOR dysfunction, can be treated and monitored. In other cases, the person will need to learn to live with oscillopsia. /r/n/r/n Generally speaking, if the underlying cause of oscillopsia is resolved, the chances are good that oscillopsia resolves itself as well. /r/n/r/n There are conditions other than oscillopsia that can cause you to see things that are not there. The cause of this may be neurological, involving the brain, ocular, involving the eyes, or psychiatric, involving the mind. /r/n/r/n Examples include, /r/n/r/n Oscillopsia is when you see things that appear to be moving but aren't. It can occur as a result of a neurological, inner ear, or eye problem that affects the vestibuloocular reflex. This is a mechanism involving the eyes, brain, and inner ear that helps you maintain balance and perceive things correctly when your head moves. /r/n/r/n Oscillopsia usually resolves on its own once the underlying condition is treated. Some people may require medications or visual therapies to help them adapt and better cope with persistent symptoms. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.